What if the most dangerous stroke warning doesn't look dramatic at all? What if it feels like something you'd normally brush off? A brief moment of confusion, a sudden loss of balance, a few slurred words that disappear almost as quickly as they came. Many people imagine a stroke as an event that strikes without warning. But in reality, some strokes are preceded by subtle signs that appear hours or even a day before the major event. The problem is that these warning signs are often mistaken for fatigue, stress, dehydration, or simply getting older. Today's video could help you recognize those signals before it's too late. If you or someone you love is over the age of 55, the information you're about to hear may one day help you act quickly, when every minute counts. And make sure you stay until the end, because one of the most commonly ignored warning signs often lasts only a few minutes before disappearing completely, leading many people to believe they're perfectly fine. A stroke happens when blood flow to part of the brain is interrupted. Brain cells need a constant supply of oxygen and nutrients carried by the blood. Without that supply, those cells begin to die within minutes. That's why stroke is considered a medical emergency. The faster treatment begins, the greater the chance of reducing permanent brain damage and improving recovery. Not every stroke arrives without warning. In many cases, the body gives small clues that something is wrong. These clues don't always happen the day before, but they can occur hours before a stroke or as part of what's known as a transient ischemic attack, often called a TIA or mini-stroke. A TIA is caused by a temporary blockage of blood flow to the brain. The symptoms usually go away within minutes or hours, but they should never be ignored. A TIA is a serious warning sign that a larger stroke may follow, sometimes within the next 24 to 48 hours. Let's begin with one of the most overlooked signs. Imagine you're having breakfast with your family. You're talking normally when suddenly you can't seem to get the right words out. You know exactly what you want to say, but the words come out slurred or mixed up. Perhaps someone asks if you're feeling okay. A few minutes later, your speech returns to normal, and everyone assumes you were simply tired. That brief episode could be much more than fatigue. Difficulty speaking or understanding language is one of the classic warning signs of a stroke. Because the brain controls language, even a temporary interruption in blood flow can affect your ability to communicate. Some people suddenly speak in a way that sounds like they've had too much to drink. Others can't understand simple conversations or find themselves using the wrong words without realizing it. If this happens, even if it only lasts a few minutes, it should be treated as an emergency. Do not wait to see if it comes back. Call emergency services immediately. Quick action can save brain tissue and may prevent a devastating stroke. Now here's something many people don't realize. Sometimes the next warning sign doesn't involve speech at all. It begins with your eyes. Have you ever experienced sudden blurry vision in one eye that cleared up after a few minutes? Perhaps it felt like a curtain briefly came down over part of your vision. Some people assume they simply need new glasses or that their eyes are tired. But sudden vision changes can be another warning that blood flow to the brain, or even to the eye itself, is being interrupted. You may lose vision in one eye, notice double vision, or experience a blind spot that wasn't there before. Because these changes are often painless and temporary, people frequently delay getting help. The brain relies on healthy blood vessels to support vision. A temporary blockage may affect the areas responsible for seeing clearly. Even if your eyesight returns to normal, the underlying problem could still be present. The next sign often catches people completely by surprise because it doesn't seem related to the brain at all. You're walking through your kitchen when one leg suddenly feels unusually heavy. Maybe your foot drags slightly across the floor. You steady yourself on the counter, wait a moment, and then everything feels normal again. It might be tempting to blame arthritis, an old injury, or simply aging. But sudden weakness or numbness on one side of the body is one of the most important stroke warning signs. It may affect the face, arm, or leg, and it often appears only on one side. A simple way to remember this is to notice symmetry. If one arm feels weak while the other feels normal, or one side of the face begins to droop, your brain may be sending an urgent signal that something is wrong. Many people wait because they hope the weakness will pass. Unfortunately, every minute spent waiting increases the risk of permanent brain injury if a stroke is developing. There's another warning sign that many people dismiss because it can happen for many harmless reasons. But when it appears suddenly, especially alongside other symptoms, it deserves immediate attention. That sign is dizziness, or a sudden loss of balance. We've all stood up too quickly and felt lightheaded. That's common and often harmless. But stroke-related dizziness is different. It usually comes on suddenly and may make walking difficult. You may feel as though the room is spinning or find yourself unable to coordinate your movements. Some people suddenly begin stumbling despite having no history of balance problems. If dizziness appears together with weakness, vision changes, slurred speech, or numbness, don't assume it's an inner ear problem or dehydration. Those symptoms together should raise immediate concern. Here's another clue that often goes unnoticed because it affects thinking rather than movement. A family member may notice that you suddenly seem confused. You might forget where you are, struggle to answer simple questions, or seem unusually disoriented. Sometimes the person experiencing the symptoms doesn't even realize anything is wrong. This sudden confusion happens because certain parts of the brain are temporarily not receiving enough oxygen-rich blood. Family members often recognize these changes before the individual does, which is why it's so important to pay attention if loved ones say your behavior seems unusual. Never dismiss sudden confusion as just getting older. Normal aging does not cause abrupt changes in thinking over the course of minutes. And here's an important point many viewers may not know. One warning sign doesn't involve pain at all, while another can involve one of the worst headaches a person has ever experienced. Most strokes are not painful, but some, particularly those caused by bleeding in the brain, can produce an extremely severe headache that comes on suddenly. People often describe it as the worst headache of their life. This type of headache may be accompanied by nausea, vomiting, confusion, stiff neck, or difficulty staying awake. While headaches are common and usually have harmless causes, a sudden, explosive headache, unlike anything you've experienced before, requires immediate emergency evaluation. Let's pause for a moment because what we've covered so far reveals an important pattern. Stroke warning signs often appear suddenly. That's one of the biggest clues. They don't gradually develop over several weeks. They can begin within seconds or minutes. Another reason strokes are missed is that the symptoms may disappear. This is especially true with transient ischemic attacks. A person may feel completely normal by the time they consider calling a doctor. Unfortunately, feeling better does not mean the danger has passed. Research has consistently shown that a TIA greatly increases the risk of a full stroke, particularly during the first 2 days after the event. That's why healthcare professionals treat these temporary symptoms very seriously. Now, let's talk about one of the easiest ways to remember the warning signs. You may have heard the word FAST. F stands for face. Ask the person to smile. Does one side of the face droop? A stands for arms. Ask them to raise both arms. Does one arm drift downward? S stands for speech. Is speech slurred or difficult to understand? T stands for time. If you notice any of these signs, it's time to call emergency services immediately. Some organizations also use the expanded acronym BE-FAST. The B reminds us to watch for sudden balance problems. The E reminds us to notice sudden eye or vision changes. These two additions help capture symptoms that some people experience before or during a stroke. Here's something else worth knowing. Certain people have a much higher risk than others. High blood pressure is the single biggest risk factor for stroke. Over time, it damages blood vessels, making blockages and bleeding more likely. The challenge is that high blood pressure often has no obvious symptoms, which is why it's sometimes called the silent killer. Diabetes also increases stroke risk because elevated blood sugar can damage blood vessels throughout the body. High cholesterol may allow fatty deposits to build up inside arteries, narrowing them and making blood clots more likely. Smoking damages blood vessels and reduces oxygen in the blood, while excessive alcohol intake can also increase stroke risk. An irregular heartbeat called atrial fibrillation is another major risk factor because it can allow blood clots to form inside the heart. Those clots may travel to the brain and block an artery. The good news is that many of these risks can be reduced. Keeping blood pressure under control, taking prescribed medications as directed, staying physically active, eating a balanced diet rich in vegetables, fruits, whole grains, beans, healthy fats, and lean proteins, avoiding tobacco, limiting alcohol, managing diabetes, maintaining a healthy weight, and attending regular medical checkups can all help lower stroke risk. These habits don't guarantee that a stroke will never happen, but they can significantly reduce the chances over time. It's also important to understand that not every stroke looks the same. Some people experience dramatic symptoms, others have very subtle ones. For example, one person may suddenly be unable to lift an arm. Another may only notice that they're dropping objects more often that morning. Someone else may briefly lose vision while reading the newspaper. Another may have trouble finding familiar words during a phone call. Because the symptoms vary, paying attention to sudden changes is often more important than looking for one specific sign. If something feels dramatically different from your normal state, especially if it involves speech, movement, vision, balance, or confusion, don't ignore it. Let's imagine two different scenarios. In the first, Robert notices his wife speaking strangely over breakfast. She insists she's fine because the words return to normal after 5 minutes. They decide to wait until the next day to call the doctor. That afternoon, she suffers a major stroke. In the second scenario, Susan suddenly notices that her left arm feels weak while folding laundry. Her daughter immediately recognizes the warning signs and calls emergency services. Susan receives prompt medical treatment, and because she got help quickly, her recovery is much better than it might have been otherwise. These examples illustrate one powerful truth. Acting quickly can make an enormous difference. Many stroke treatments work best within the first few hours after symptoms begin. That's why healthcare professionals often say, "Time is brain." Every passing minute means more brain cells may be affected. One mistake people commonly make is driving themselves to the hospital. Instead, calling emergency services allows trained professionals to begin evaluating and supporting the patient immediately while on the way to the hospital. It also helps ensure the patient is taken to the most appropriate facility as quickly as possible. Finally, remember this. Never worry about overreacting if you suspect a stroke. Healthcare professionals would much rather evaluate someone whose symptoms turn out to have another cause than miss the opportunity to treat a stroke early. Your brain cannot tell you directly that blood flow is failing. Instead, it speaks through changes in movement, speech, vision, thinking, and balance. Learning to recognize that language may one day protect your health or even save someone else's life. Today's message isn't meant to create fear. It's meant to build awareness. Many strokes cannot be prevented entirely, but recognizing warning signs early and reducing risk factors can improve outcomes and, in some cases, prevent a larger stroke from happening. Take a moment today to think about your own health. Do you know your blood pressure? Have you had your cholesterol and blood sugar checked recently? Are you taking medications exactly as your healthcare provider prescribed? Small steps taken consistently often have the greatest impact over time. And perhaps the most important takeaway from today's video is this. If sudden symptoms appear, even if they disappear, don't ignore them. Seek emergency medical care immediately. Minutes matter. If you found this information helpful, we'd love to hear from you. How old are you? And which country are you watching from? Have you or someone you know ever recognized a stroke warning sign in time? Your experience could encourage someone else to act quickly when it matters most. Thank you for spending these moments with us. By learning these warning signs today, you've taken an important step toward protecting yourself and the people you love. Stay informed, stay proactive, and we'll see you again in the next video.